Let me. I will call to order this meeting. Everybody come in and get seated and quiet down. Okay, at 12 o'clock, we're going to call to order the Health Subcommittee meeting for the House. Glad to see everybody here today. We seldom ever break records here, but I think we did today. Welcome to everyone, and Madam Clerk, if you'd please call the roll.
Representative Boyd, Representative Byrd, Representative Freeman, here. Representative Hall, here. Representative Jernigan, Representative Kumar, Representative Marsh, here. Representative Ramsey,
here.
Representative Sherrill, here. Representative Smith, here. Chairman Terry. Here. Chairman, you have a quorum.
Thank you, Ms. Clerk. Do we have any personal orders this morning or this afternoon? If not, I would say welcome. I noticed the T-shirts, and I had to get up close to read them. I think we have our food truck representatives here today. Welcome. And several other folks, but hope you brought some samples. We'll meet you out in the hall. So if there are no personal orders, we will proceed with today's calendar. We have first House Bill 2120 by Chairman Curcio. You are recognized, sir. Have a proper motion second on the bill.
Thank you, Mr. Chairman, and thank you, committee. Glad to see such a good turnout today. I do have an amendment which I wish to move. It's coded 13966, and it does make the bill.
Have a proper motion and second on the amendment. Since it makes the bill, let's go ahead and vote to put the amendment on the bill. All those in favor say aye. Any opposition? We're on the bill as amended. You're recognized on House Bill 2120.
Thank you, Mr. Chairman, and thank you, committee. Members, what I'm here to talk to you about today, without being overly dramatic, is really the purest form of American capitalism. It's hard to imagine a more free market opportunity than a U.S. citizen with an idea, an opportunity, a skill set to say, you know what, I'm going to take this show on the road and try to make a living at it, and that's a food truck, right? Many of our most favorite restaurants were started out in the back of somebody's house or in a food truck or at a fair or at a flea market, and today they're thriving business owners. My grandfather was first-generation Italian-American, came to New York City, got his start in the restaurant business. My father and I, my wife, my father and I, all three of us owned a restaurant in the city of Dixon where I live for a number of years. And what we always said was, the thing about restaurants is you just need more of them together in a cluster and concentrate to help that tide raise all of those boats. And so many of you may have been surprised to find out when I came and talked to you about this bill that food trucks have actually been subject to a patchwork of regulations across the state. And in some jurisdictions, or even just outright banned or outlawed, even on private property, which is ridiculous in my opinion. So what my bill would do is seek to right that, correct that ill. It would allow municipalities to regulate their own property that they own, and it would allow private property owners to make decisions for their own properties. But I have been approached by some folks with some questions. I think they're very valid, so I wanted to address some of those before we have some folks here who want to testify. The biggest one, or the first one that I hear, is that food trucks don't pay taxes. That's absolutely false. I don't know if you've seen some of these rigs, but they can cost upwards of $150,000, $200,000. So these Tennessee taxpayers are paying taxes to the state when they purchase that vehicle. They also pay sales tax. So wherever they're registered as a business, if they're registered in Dixon County or Cheatham County or Clay County, they're going to pay sales tax to that county where they're registered. They also must submit to the fire marshal's inspection. They also submit to the health department, just like a restaurant does. So they get a score, just like you're accustomed to seeing in a restaurant. And that's an annual inspection, plus they have random inspections as well. There's some questions about public These being a public nuisance, which I certainly don't see them as that, but I just want to draw your attention to some of the language in the amendment that would address that. It says here, a mobile food truck shall be maintained in good operating order as applicable, provide a marked waste receptacle for customers and request customers to use the receptacle, so they can't just, wonder where the trash goes. They've got to have a plan for that. Collect, remove, and dispose of all refuse within 25 feet of the mobile food unit's operating area at the conclusion of service. Submit and pass health inspections required pursuant to this part, and annually submit and pass one local fire inspection anywhere in the state. A local authority shall not regulate or prohibit the operation of a mobile food truck on private property except, and this is a question I get too, well, does your bill allow somebody to open up a food truck in a residential neighborhood but serve to the public? The answer is no, and let me talk about why. So it says the local authority may enforce health and fire inspections required pursuant to subdivision B, 4, and 5, enforce generally applicable laws regarding municipal offenses, including offenses against the peace and quiet, trespassing, and interference with traffic. I think that's very important. People say, well, they're just going to set up a food truck down Main Street in Dixon and block 2 parking spaces and start selling hamburgers in front of a brick and mortar restaurant. Absolutely not. If they do that, the cops need to come and run them off. They would be in violation of not only local municipality orders, but blocking traffic, blocking the free flow of traffic. And then it says a local authority may regulate, restrict, or prohibit the operation of a mobile food unit in residential zoning districts. So again, we are not turning neighborhoods into restaurant, food courts, but a private property owner may be invited by a private property owner or homeowners association in that district to operate on private property for a social gathering or event. So think about my kid's birthday party. If I want the Xander's pizza truck to come up and make pizza for all the kids, they can do that on my property because I've invited them there. But this bill would limit that to an 8-hour period. And if at any time I'm violating a noise ordinance or doing anything else that's in violation of the peace and quiet of that neighborhood, the city absolutely has the authority, and I would say the obligation, to shut me down or to come by and tell me I need to be quiet. That duration of time, again, does not exceed 8 hours within a 24-hour period. And then I think, very importantly, this section does not limit or prohibit a local authority's ability to enforce local laws governing the sale or consumption of alcoholic beverages. So I'm thinking a lot about this. I've heard from some folks who oppose it, and actually I was sent a copy of a very detailed ordinance by the city of Nashville. And as I read through this thing, it reminds me a lot of when I watched Milton Friedman's series, Freedom to Choose, about how we've never seen something as government or central planners that we didn't want to regulate and overcomplicate. And I would invite you to take a look at this if you want to see government at its worst and completely in action. And so finally, I'll sum up with this before I take any questions. Our 39th president, Ronald Reagan, said government's view of the economy could be summed up in a few short phrases. If it moves, tax it. If it keeps moving, regulate it. And if it stops moving, subsidize it. It's exactly what's happening with food trucks across the state. All we're seeking to do is level the playing field so that whatever jurisdiction you're in, you know what the rules of engagement are, and you can operate safely and effectively in a manner that is compliant. Again, this bill would also preserve local government's ability to regulate on their own property. So if they want to issue a permit to be in a city park or even in the parking lot at City Hall to serve their employees, they can absolutely do that. We're just saying that whatever a private property owner works out between them and that food truck vendor is between them. They're already paying taxes to the state. They're already regulated by the state. They're inspected by the state. And that's what this bill seeks to do. So be happy to take any questions.
Well done. I'm glad you did mention the brief and limited opposition. My cities have contacted me with that same thread in mind. So do we have, yes, you recognize Coach Byrd, or pardon me, Chairman Byrd.
Thank you, Mr. Chairman. What about residential areas? And I might have missed you. You might have already talked about that.
It's okay. No, I'm glad you asked, because that's a question I keep getting over and over again. So this would in the bill, it says that municipalities may enforce generally applicable local laws regarding municipal offenses, including offenses against the peace and quiet, trespassing, and interference with traffic. It also says that they can regulate, restrict, or prohibit the operation of a mobile food truck in a residential zoning area. So what this bill would absolutely not allow is for, I live in downtown Dixon, for example, and especially when there's like a 5K going on or something like that, there are members of the general public that walk through my neighborhood. That's not uncommon. What this bill would not allow me to do is invite a food truck operator into my driveway and sell to those people who are walking by on a Saturday.
Okay.
What it would allow me to do, though, is for when my youngest turns 7 here in a couple of weeks, invite a pizza truck into our driveway to serve pizza to all the children that come to that party, their parents, so on and so forth. We would probably buy the truck out. In other words, I would just pay the pizza owner at the end of the deal because I don't want to charge the kids for coming to the party. But you know, although it's not a bad idea. But that's where you could have them on your private property and they're able to serve. But you can't do it for more than an 8-hour period within a 24-hour period. And it's got to be for a social gathering or a party, something like that.
Okay. Thank
Chairman
you.
Byrd.
Thank you.
I think Bob Freeman, Representative Freeman, you're recognized.
Thank you. And Chairman, we talked a great deal about this, and I think the world of you. You know what's coming next.
Yeah.
And I also love food trucks, and exactly what you're saying, I have personally done on numerous occasions. Every year for Halloween, we close our street and we get a bunch of food trucks that come in. I literally got on social media so I could follow a local company here that did tater tots and grilled cheese, and so I'm a big fan of food trucks. But as I look through this, you know, there's nothing more local than local zoning requirements, and we create in every different municipality where we allow businesses to operate. And doing away with a municipality, you know, what makes sense for Nashville may not make sense for you in Dixon, or you know, may not make sense for some of the other members that are other parts of the state. And the number of both food truck operators and restaurant business operators that have called me with great concerns that while they do pay sales tax, the infrastructure costs for police and fire, for wastewater treatment, storm sanitary wastewater treatment, is all handled through predominantly property taxes on a local level that these operators are not currently paying. When you build a new restaurant, you have requirements on ADA accessibility for this, and I see nothing here requiring any ADA accessibility requirements if you're on a private property with a publicly operating business. We have nothing that says anything about reasonable parking. If something happens inappropriately, the police have to show up, and that's again on the backs of the people of the community to pay for. And so while I genuinely appreciate the idea, and I think that if someone wants to have a food truck, they should be able to have a food truck, but the regulation and safe operation for all of the operators in this room, they want to know that when a customer comes to their facility, that they are getting the best possible product out there, and part of that is through supervision from a municipality. And if you remove the ability, it just gives me great concern. And furthermore, having somebody who's invested a great deal of money in a brick and mortar facility to be able to have their neighbor lease their space to somebody else that can undercut them, that again doesn't pay any of the infrastructure costs, I think is a problem. And that's why I got phone calls from several people in my community, and we had a representative who represents Gatlinburg call around. he had great concern with this. And so while I appreciate the thought, I think it might need a little tweaking for me to be able to support it.
Chairman Curcio.
Thank you, Mr. Chairman. And I do want to just respond to a couple of those things because I've been asked about, the parking requirements and what happens if the cops have to be called. And the example that was given to me, locally, being from a small community, was what if Walmart invites so many food trucks to operate in their parking lot that it then blocks their parking so they don't have the required number of parking, and we have to send the cops out there. Those food truck operators haven't paid anything to support the police force. Number one, your beef's with Walmart. They pay a whole lot of property taxes, right? So they're the ones that are in control of their parking lot, and if they did something to block their parking lot, the city's got a problem with that property owner. Say, look, you didn't live up to your end of the bargain. We said if you were going to build this big box store here, you had to have 500 parking spaces, and because you've invited these food trucks in, you've only got 200 parking spaces. So I would say that the cities are being compensated handsomely now to be able to enforce their current regulations. The other thing that I've heard is this argument about a brick and mortar. Again, I come from a multi-generational restaurant family. When we had our restaurant in downtown Dixon, what we needed was 50 more restaurants all around us, and I didn't care if they had the exact same menu as me. We needed more traffic. Food trucks absolutely bring traffic in areas where there's already an attraction. So the example that I would give is that when I buy a taco from a food truck vendor, it hasn't replaced me buying a hamburger and a beer at the sports bar that's brick and mortar. Number one, that food truck operator doesn't have a liquor license. They don't have a dining room. I can't watch an Ole Miss game from that food truck operator. I'm gonna have to go inside a restaurant and do that if that's what I want to do. The other thing that we know, and we've seen studies that prove this, is that when I then go to that area and I buy that item from that food truck owner, I then walk around and I'm going to spend a lot of other money at retail stores because it keeps me in that downtown area longer. It makes them more sticky to me because we're going down there for an event. The kids may get a snow cone, I may get a taco. My wife may want to go into the spa and get a massage or a nail treatment while we're shopping up and down Main Street. So these absolutely help drive not only the sales tax that they generate, but also help pay for all of the infrastructure around them by patronizing those other businesses, a traditional brick and mortar or what have you. And so I have gotten that question a lot. And again, I could absolutely sympathize with that as a person who owned a restaurant. I'll also say this. I've had officials name restaurateurs by name and say, well, you're going to hurt so-and-so. They've got their life savings wrapped up into their brick and mortar business. So then I'll go to that restaurant owner and I'll say, I'm so sorry. I hope you haven't taken offense to my legislation because I don't want to hurt you. And they'll say, why was that city official using my name? I'm not against this at all. In fact, I'd love to be able to operate a food truck. I would love it if there were food trucks in our area. Please tell them to stop using my name. So I think if you actually go to those folks, you'll find that they have a completely different view of this, that more density brings more people, brings more economic activity. And but I do appreciate you bringing those things up because they are common things that I'm hearing, I know members of the committee are hearing, and so I appreciate the opportunity to be able to address them.
Representative Freeman.
Yeah, thanks again. That was low down bringing up Ole Miss to this. That was, listen, and I'll say it again. I'm a huge fan of food trucks, and I think that there is absolutely a place for them and for those small businesses to operate. I just believe that a municipality should have the ability to control their own destiny there, and some of it. Just removing that ability. If it was purely that they can't prohibit, I'd be on board. I really would. And I ultimately think that's your issue, is that you don't want a municipality to prohibit food trucks. I just think it goes a little further, which gives me concern. Sure. I'd love for a food truck to pull up out front of the Capitol every day and serve us all lunch. Or let us buy lunch, not service lunch. But I think that there is, the issues that we have here in Nashville are totally different than we have in other areas, and the issues you have in Dixon are totally different than what we have here. And having a one-size-fits-all and not allowing those people who live, you live in that downtown community have some say in letting us make these decisions up here in Nashville. I just don't think that's the right way to handle it. But I'm not sure we're going to agree.
Chairman Curcio.
Thank you. I don't want to bore the committee, but I just want to remind everybody, this does allow cities to enforce their already, their codes that are already on the books as far as public nuisance and ordinances of that nature. It also would not allow them to sell in a residential area. So I just want to clarify that. So if a property is owned commercially, then that's what we're talking about, where if I want to make a deal with the MAPCO owner and the MAPCO owner is okay with me sitting in their parking lot on a Saturday, and the guy says, give me 6% of your sales, or just pay me a flat $500 and you can hang out there for the day. That's what we're talking about. I don't think the city needs to add an extra layer of taxation and regulation on top. And one thing that I neglected to say too is that if cities want to levy a restaurant tax, that's what I keep hearing is, well, what about the property tax? Well, that's for property owners. If cities want to levy a restaurant tax, by all means, good luck getting that passed through your city council or your metro council. I think you'd have a pretty big uprising on your hands. And so property owners pay property taxes. People who sell things pay sales tax. People who purchase things like $150,000 food trucks pay sales tax when they purchase those trucks. So I just think they're taxed enough. I think we need to create a level playing field across the state and allow the free market to function.
For the questions, comments, I did have a question come to me. Excuse me. I take it from the discussion on the bill that it does not in any way limit food truck operation near restaurants. Your bill does not address that in any form. Is that correct?
That's correct.
Yeah.
That's correct.
Comments or questions? Yes, Speaker Marsh.
Thank you, Mr. Chairman. Do you have to have a business license to run one of these trucks?
Chairman Curcio.
Thank you, Mr. Chairman. Great question. I'm glad you asked that. So I guess in theory, you could be a sole proprietor. So if you could open a business under your name, under your Social Security number. Now, you would still have to submit sales tax in order to do that. I would counsel you, though, if you ask me advice, I would say don't do that, because you have no liability shield if someone wanted to sue you in your capacity as the business owner, the person responsible there. You have no liability shield. So often what every small business owner will do is they'll form an LLC. So wherever you formulate that LLC, you're going to pay taxes as an LLC, and the sales tax revenue that you generate will be credited to the county where you're registered as a business owner. Now, they could be different though. One food truck may have an S corp, one may operate under an LLC. So they're going to be different, but they're going to have some sort of business license or business that they've established legally, if for no other reason, for that liability shield.
Speaker Marsh. Okay. Further comments or questions? If yes, Chairman, excuse me, Jernigan.
Yes, thank you. Thank you, Chairman, and I'm generally with you on this. I'm on the bill. But you just brought up Nashville's ordinances about being heavily regulated. I think you.
I love Nashville, by the way. I just want you
to
to
hold up.
Chairman Curcio.
Good, I do too. And so, out of all those regulations that you just held up, do I understand that Nashville's still able to enforce those regulations as far as local laws?
Chairman Curcio.
Thank you, Mr. Chairman. Yes, they would absolutely, even if my bill passes, could still enforce those on property that they own. So Dragon Park, where I used to go play a lot when I was a kid after violin lessons at Vanderbilt, that's a city park, I think. And so if the city of Nashville wanted to keep every single one of these regulations in place, and I anticipate that they would, I don't know why they would, scrap them after this bill passes, they would be able to issue permits on their own property. And I think that's appropriate. What this bill seeks to do is respect everybody's private property rights. So property that the city owns, they can make that permit as high and as rigorous as they want to. If they're trying to restrict food trucks, that's probably what they'll do. If they generally want to be more food truck friendly, they'll either have, they'll have little to no regulation or a very low permit, but it would actually absolutely preserve their ability to do that.
Okay.
Chairman Jernigan.
The second one I had, and we spoke about this but I just want to make sure I have it right and it's on the record about a property owner who invites someone to their property for a social gathering or an event. When does that become chronic, I guess, is if they have an event and it's a personal property and maybe, it's residential, but it's in a prime location to where they're having an event or calling an event. Maybe there's a week-long festival, I don't know, but they're having an event every day. When does that become chronic? When does that trigger of, okay, you're no longer doing this for a kid's birthday party?
Sure. Chairman Curcio.
Thank you, Mr. Chairman. Excellent question, and this is something you and I talked about in my office not long ago, but that would be up to the local municipality's other ordinances. So again, I would draw your attention to Part B, enforce generally applicable laws regarding municipal offenses, including offenses against the peace and quiet, trespassing, and interference with traffic. So specifically there to peace and quiet, if I hosted, it's my understanding that I can have a party at my house and I can even have live music at my house under my local city's ordinances, but it's got to stop at a certain time. And so everybody understands that your cousin gets married and you want to let her have a party in your backyard. That's well-worn ground, right? But what we also know is that if you're doing that in a residential neighborhood on your own property instead of renting out an event center, you've got to play by the city's rules. One of those rules is, hey, 10 o'clock, guys, you got to shut this thing down. There are other ordinances that would restrict me from being able to have a party, every single day that's a public nuisance and a public hazard. Those are going to be at the local level, so I can't speak specifically to what would be, in your neighborhood. I know in my neighborhood, we've had to look at that. I live in a family home. We've hosted, including my parents back in the 60s, long before I lived at my house, obviously, because they weren't married yet. My parents' wedding was there. We've had, I think, 15 family weddings at our house. Most recently, one of my cousins wanted to get married there because her mother got married there. But we had to call down, we checked the local ordinances to make sure that the band that they hired wasn't going to cause a problems. We called our neighbors, say, hey, we're having a party, come over if you'd like. Always a good, practice, right, to invite your neighbors to your party. But if that were something that we were doing 4 or 5 days out of a week or every single weekend out of a month, the city would absolutely shut me down. I mean, that's really designed to be a one-off kind of a thing. And again, the local municipal ordinances would speak to that.
Chairman Jernigan.
So the city could shut you down under this bill? Is that under B? Is that right?
Yes, sir.
Chairman
Absolutely.
Curcio.
Absolutely. And not only is the answer to that question yes, that is absolutely my intention.
Okay. Thank you, sir.
Further comments or questions about the bill as amended? If not, before we take the vote here, let me just say that we'll be sending this to the full committee to vote on this issues to the full committee. All those in favor say aye. Aye. Any opposition? No. Call the roll, Madam Clerk. A vote yes will be to send this bill as amended to full committee. A vote no will be to deny the passage.
Representative Boyd, Representative Byrd, Representative Freeman, Representative Hall, Representative Jernigan, Representative Kumar, Representative Marsh, Representative Ramsey,
Yes.
Representative Sherrill, Representative Smith, Representative Terry. Chairman, you have 5 ayes, 1 no.
The motion passes.
Thank you, Chairman. Thank you, committee.
Thank you, Mr. Chairman. Before we go any further, let me take just a moment here to congratulate a group of folks. This is Tennessee Hospital Association Day on the Hill. I want to congratulate all of you that are here today on a job well done over the last couple of years. We've depended heavily on you to maintain the health status of our state. We have with us today hospital leaders from across the state. Is anybody here from Blunt Memorial? I don't see a hand, but we certainly welcome all of you. We appreciate the effort that you make to be here. Nobody can put a price on volunteerism, and I know it's hard to come up here and visit with us, but I appreciate the effort. So we'll move on to item 2, House Bill 2537 by Leader Gant. You're recognized. Have proper motion and second.
Thank you, Chairman and committee. What this legislation is, it somewhat mirrors a piece of legislation that I brought to you 2 weeks ago about federally qualified centers. And I've got an amendment that's going to be coming before we go to full. If y'all will let me get this out and get it to full, there's an amendment that's going to come in and strike out the language that deals with the federally qualified health centers, because obviously we've already passed that. So this legislation would override that. So the amendment that I'll bring in full will take care of that. And I want to be very clear. This is my legislation, not TMA, not the Nurses Association or anybody else. This is the legislation that I'm bringing. So I think there was some confusion on that with some of the talk that's been going on, so I want to make that perfectly clear. So what this legislation does is it takes your private practice and allows your physician assistants and your nurse practitioners to be able to do the same thing by remotely working with their physician, but doing it from a virtually electronic virtual format. And in this legislation, it would require 2, out of the whole year, it would require 2 on-site visits by a collaborating physician. So, Mr. Chairman, that's pretty much the gist of the legislation. I'll be glad to answer any questions.
And Leader Gant, we have a kind of a dilemma up here. You have already filed from your office 13608, the amendment, and I think that's what you just described to us.
Right, but it's not timely filed, though, Mr. Chairman.
My understanding is that it is.
Oh, okay.
Which gives me a whole lot of relief, because
Okay.
I thought you were going to.
I didn't realize my staff acted that quickly, so I apologize.
I thought you as a leader were coming in and saying, pass this and we'll fix it on the highway, which we try to stay away from. So I'm highly relieved that you've taken care of business.
Okay.
However, we do need
I stand corrected.
We do need a motion and a second on that amendment. Have a proper motion and second on the amendment. All those in favor of the amendment being placed on the bill, say aye. Any opposition? We're on the bill as amended, and I think you have discussed the part of it that you needed to. Did you have requests for testimony?
I did not know.
Okay. Do we have any and the issues that came to me were there was some conflict between this and another bill, and apparently this amendment works that out to some degree.
That is correct, Mr. Chairman.
Okay. So since you haven't requested a testimony, we will we'll take questions here, and then we have Kathleen Murphy has requested that she be allowed to address the bill. Do you want her to go ahead and give testimony? Or
I'm sorry, Mr. Chairman, I didn't hear you.
Okay. Since you have not requested any testimony, we have had a request from Kathleen Murphy with the Nurses Association to give testimony on the bill. Would you prefer to have that before or after we have questions from the committee?
It's totally up to you, Mr. Chairman.
Okay. So we're on the bill as amended, and what we'll do is go out of session, recognize Kathleen Murphy, and you can come up and give us your testimony, and we'll the 3 minutes, and we'll stand for questions and answers after that. So we're out of session. No objections. We're going out of session.
Thank you, Chairman. Kathleen Murphy with the Tennessee Nurses Association. We have been talking with Representative Gant up until walking into the meeting today, and so I appreciate still being allowed to be heard. I think Representative Gant and I will be able to work through some of the issues on this legislation. I think that there's been some different ideas put forward, and the amendments do not necessarily reflect what we had expected to come out of the caption process here. And so on one hand, we would prefer that it be held here in subcommittee so we can work out and make sure everybody's on the same page with the amendment before it moves forward. I understand that Representative Gant does want it to move forward today and smooth out the bumps before full committee, and obviously we're at the will of the committee and at the will of the sponsor to help him do that. I just wanted to express the perspective of the nurses here is that this is continuing to kind of set up different standards of collaboration and chart review depending on different settings that a healthcare provider works in. And we think that can set up confusion and a little bit of discrepancy and potentially some discrimination based upon the setting that a nurse practitioner or any type of advanced practice registered nurse works in. There shouldn't be a different standard based on that setting. And so that's our concern here is if you all have already decided that federally qualified health centers should not have to have any on-site reviews, if the community health centers should not have any on-site reviews, then why are we setting up this kind of different tier for advanced practice registered nurses and other settings? And so that's where we'd really like to get that worked out and smoothed out prior to this moving forward. But again, willing to continue to work with Leader Gant to try to make sure that we're all on the same page here. I just wanted to make sure that we expressed that view, and I'm happy to answer any questions.
Do we have any questions of our expert witness? If none, we'll appreciate your testimony.
I appreciate being called an expert.
Oh, yeah.
Thank you so much.
Yes. No objections. We're back in session, and I recognize Leader Gant.
Thank you, Chairman and committee. The conversations I've had with Kathleen and representing the nurse practitioners is over two. There's the way I'm just going to read the language so it's clear. An advanced practice registered nurse with a certificate of fitness issued pursuant to this chapter may arrange up to 10 of the 12 required annual remote site visits by a collaborating physician. So the differing views here is just 2 visits per year. So I think they want to see all 12 under virtual, where under this piece of legislation, there's 2 months that it would not be.
And my understanding is the way that it is right now, there have to be 12 on site.
That is correct, Mr. Chairman.
And so what your bill is amended.
We're taking 10 of those away.
Taking 10 of those away. And the complaint that we've heard is that that sets up a different category that is not conforming across the categories of providers. Is that the way you understand it?
That is not correct. It's over the 2 months out of the year that the collaborating physician would have to come into the clinic and review the charts.
Right.
And Mr. Chairman and committee, we can continue this conversation, between now and full, and I would appreciate if you could help me get this out of here so we can have that conversation and talk about a possible amendment that may be accommodating in that format. But I think this is more than fair, and I've talked to many of the nurses and doctors in my district and across this state, and they concur this is a huge step forward for nurse practitioners.
Do we have comments or questions? I'm always uncomfortable when people tell me they're going to fix something on the highway between committees. But we, certainly it's up to the committee. Speaker Marsh, you recognize.
Thank you, Mr. Chairman. Now, as I understand you're wanting 10 of the 12 to be virtual, and they're wanting all 12 of the 12 to be live or in person.
They want all 12 to be virtual. I'm sorry, Mr. Chairman, I didn't.
Speaker Marsh.
I'm just trying to understand. I mean, I think virtual is a pretty good way to go myself. I'm just trying to understand what the problem is here. Now, have you had a lot of nurses contact you saying this? Is this what we're doing now under Governor Lee's administration? Has he eased some of the restrictions that we're doing this with now?
You're talking about,
Leader.
through some of his emergency orders?
Uh-huh.
I think most of those have expired.
But were we doing this? Your procedure during the?
I can't answer that question. I'm sorry.
Does anybody want to have further testimony from the nursing group? Does anybody got any questions, any comments? Certainly it's up to this body as to where we go from here. Yes, sir, Speaker Marsh.
I'll make a motion. We'll go ahead and vote on it.
To move it forward. We have any objections to that motion? We have a second. Dr. Terry, I think, second. So if there are no objections, we will be voting to send this to full committee. And I do want, our staff had said, as before, even though we've amended the bill, there still is a conflict between portions of the bill. They notify Section 5 and Section 6. So my recommendation would be to address that when you make your alterations between here and full committee.
Yes, sir, Mr. Chairman.
Okay. So we will be voting to send this bill to the full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Chairman and committee.
Okay, thank you. We'll move to item 3, House Bill 1686 by Chairman Williams. You are recognized. We have a proper motion and second on the bill. And we have an amendment that makes the bill, I think.
It's a minor change of mandatory language, Chairman and members. Sorry, I was trying to keep Representative Leader Gant together there. It's an amendment that simply changes the. I'm sorry, you're correct. It rewrites the bill, drafting
Okay.
code 013-884.
Okay, we'll stand for a motion and second, have a proper motion and second on the amendment. Let's put the amendment on the bill. All those in favor of the amendment say aye. Any opposition? We're on the bill as amended.
Thank you, Chairman and members. This bill would create a pilot program for Alzheimer's care across the state, a respite program. Currently in the state, and the amendment, the only language that the amendment changed, allowing for the reporting of costs to be through the AAADs in our communities. But many of you may or may not know that I lost my grandmother 2 years ago to Alzheimer's after 9.5 years. Struggle with it. One of the biggest challenges we find with family members who have Alzheimer's is the family members try to care for their needs. And if the longer a family can care for the needs of their loved one, the more we can keep those people out of long-term care when they have Alzheimer's. What this respite care program, it will be a pilot for 3 years. It'll allow for 150 families across the state to get 3 or 4 hours a week of respite care. It's very important. Those people will be able to go to the grocery store for them and their own families. If it weren't for my 2 aunts and my mother, it would have been very difficult for my grandmother to stay in her own home for as long as she could. What this would do is give support to those families across the state. The bill is named after Colonel Bowden, which is in Representative Sam Whitson's district, who also is an advocate for Alzheimer's. We're hopeful that through this pilot program we can do some measurable some measures to find out if we were able through this respite care program to keep people out of long-term care and that they would be able to stay home. I'm happy to answer any questions the members have. regarding the amended bill.
First, and thank you for that explanation. First, let me thank you for bringing this bill. You understand that people of my age are probably going to be more affected than some others. But do we have questions or comments, Representative Freeman?
Thank you, and thank you. This is phenomenal. My grandmother also passed, and so anything we can do to make this better, I think is a move in the right direction. I do have a question. It says the program is going to be operated using the agency's current respite care infrastructure. Mm-hmm. Is that, what agency is that? And I know I'm a big fan and supporter of the Tennessee Respite Coalition, and I'm just curious if that's the agency or who is going to be operating that?
Chairman Williams.
Thank you, Chairman and members. Thank you for the question. Currently, there was the original bill said it would be housed in the Tennessee Association of Commission on Aging and Disability. This bill, as amended, would say it would be for the AAADs, which most of us have in our communities already, and those monies would be distributed to them, and then therefore distributed much like any of the other care programs that we have, whether it's choices or those, and so that's where the money would end up going. I will say that, as an addition, Chairman and members, this is not new to the United States. The state of Florida passed similar legislation many years ago, and they found that it was of great benefit to its citizens, and the governor of Florida this year added an additional $15 million to the budget for this kind of care, which we hope that we find that in the future we can help our citizens in the same way.
Chairman Terry.
Thank you, Chairman. I'd like to thank the sponsor for bringing this legislation, and I really do look forward. And first of all, afterwards, if you can get me a sign-on sheet, I will sign on. But I do look forward to some of the information that we do get back, because the value to the caregivers, but also to the individual as well. You brought the point up. When they go into an unfamiliar surrounding like the assisted living or the nursing home, that can sometimes, when you get them out of a normal environment, they may go down much quicker, mm-hmm. and require greater amount of healthcare dollars on that end. So this may be a short-term or small amount on the front end that saves us on the back end. In addition, with the families that go through this, it is such a difficult situation, and for them as well, just getting time out to do normal things and bring things back in, I think is going to show us great dividends. And so I applaud you for bringing this.
Thank you. Thank you. Do we have further comments or questions on the bill? If not, we'll be voting to send this to full committee. All those in favor say aye. Aye. Any opposition? So approved. You are recognized, Chairman Williams, on item 4, House Bill 2447.
Thank you.
Have a proper motion and second on the bill.
Thank you, Chairman and members. This bill seeks to make changes to the physician referral law in Tennessee. In 1989, the United States enacted the Federal Physician Self-Referral Law, commonly known as the Stark Law. The Stark Law prohibits physicians from referring patients to any entity or healthcare services if the physician has a financial relationship with that entity, with a few exceptions. Soon after 1989, a number of states adopted what we call mini Stark laws. These laws were modeled after the state statute or the federal statute that provides state boards pathways for disciplining unethical physician self-referrals in the states. Tennessee adopted its own mini Stark laws in 1989, set forth in Title 63. This bill, due to the ever-evolving change in health care, the nature of this federal Stark law and several states, including Tennessee's neighboring states of Virginia and Tennessee, have added provisions to their mini Stark laws to clarify that any business arrangement which is or may be permitted under the federal Stark law shall also be permitted under the state's mini Stark law. This bill, similar to Tennessee's law, has several benefits. The bill would align its federal and state Stark laws together. If a business arrangement is prohibited under the federal law, it would also be prohibited in Tennessee. And if a business arrangement is permitted in federal law, then it would also be permitted in Tennessee. This bill would eliminate the need for the General Assembly to update its mini Stark laws based upon federal changes. And the bill would also allow for the Tennessee Board of Medical Examiners to discipline any medical providers of any unethical behaviors. And finally, this bill would promote greater access to health care services for patients, particularly in rural areas like mine, by removing barriers between physicians and their practices in neighboring areas. I'm happy to answer any questions the members might have.
Okay, then, thank you for the explanation. It's reassuring to see that the board still retains authority over the situation. Do we have any comments or questions on this bill? If none, no objections, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Chairman and members.
Great job.
And
Thank
I did go see the clerk's office, and I asked him to turn the air down in here for you guys. So.
We have, we have House Bill 1903, item 5 has been rolled 1 week. House Bill 2535, item 6 has been rolled a week. Item 7, House Bill 2545 has been rolled 1 week, and number 8, House Bill 2778 is rolled 1 week. All of those bills are sponsored by Representative Alexander. Item 9, House Bill 2465 by Chairman Leatherwood. He comes. Oh, well. You are recognized, sir, on House Bill 2465. We have an amendment that makes the bill. We have a motion and second on the amendment, and let's make sure we have a motion and second on the bill. I missed that. Have a proper motion and second on the bill and the amendment. We're going to put the amendment on the bill since it does make the bill. All those in favor say aye. Any opposition? So approved. We're back on the bill as amended. You are recognized for an explanation.
Thank you very much. I appreciate that. This is another easy bill. The goal of the legislation is just to expand access to naloxone, by authorizing standing orders for substance abuse treatment providers for them to train and make it available for their employees.
And my understanding is that when naloxone became available and became very commonly used to interrupt opioid overdose, the state of Tennessee was one of the first states to actually promote and evolve a standing order, but that order came from the Department of Health, the Commissioner of Health. And so my understanding is that sort of antiquated situation has left some populations not able to obtain the naloxone. Specifically, these are for folks that can't pay for it with insurance and are involved in rehab and some kind of treatment. Is that pretty close to?
That is
and
correct.
So this bill actually alters that standing order to give them accessibility to the naloxone for people that are at risk.
That is correct, and it's my understanding the amendment actually came from the Department of Health.
So do we have any comments or questions? And the reason I'm so interested in the bill, it's similar to a bill that I have coming up in a week or two, and but they're for totally different populations. So I just want to get everybody to understand this is a bill for a specific group of people that's left underserved, and so mine is for a different population. So we have questions or comments from the sponsor on this bill? Question has been called. If no objections, we'll be voting to send this bill to the full committee. All those in favor say aye. Any opposition? So approved.
Thank you very much.
We'll move on to House Bill 2314, item 10 by Chairman Griffey has been rolled 2 weeks. And we're on item 11, House Bill 1897 by Chairman Halsey. You're recognized.
Thank you, Mr. Chairman, and thank you, committee. This bill requires employers of health care providers.
Let me put I think there's an amendment that makes the bill.
You're exactly correct. I'm so sorry.
We have a proper motion and second on the bill. Let's get a proper motion and second on the amendment. We have a second on the amendment. We have a proper motion and second on the amendment. We are on the amendment itself. All those in favor of placing the amendment on the bill say aye. Any opposition? We're back on the bill as amended. You're recognized on the amendment that makes the bill.
Thank you, Mr. Chairman, and thank you, committee. This bill requires employers of health care prescribers to report to the Tennessee Bureau of Investigation and local law enforcement, as well as Department of Health, anytime they run into an instance where somebody has diverted drugs by fraud or just stole them, any controlled substance, and that particular crime that goes with it, to dispense it or administer it or acquire it by fraud or forgery or deception or subterfuge, that it has to be reported. We have reporting laws here to report forced reporting of child abuse and elder abuse, and that's what this bill does. It just says these types of crimes by healthcare providers have to be reported.
Do we have comments or questions? Yes, Representative Freeman.
Thank you. So currently, if somebody, it's against the law to illegally obtain a controlled substance, and that would include fraud, forgery. So are they not being reported now? Is that what we're dealing with?
Chairman Halsey.
Thank you. That's exactly right. There seems to be a mechanism where if they get caught or suspicion that a nurse is stealing somebody else's medication, sometimes the provider or the employer will just fire them, and it doesn't get reported, and they go hire on someplace else and do the same thing. There is a mechanism that the TMA, I think, supports that says they can, when they get caught, they can say, yeah, I'm addicted, I have an addiction problem, and I'd like to go to rehab, and they get sent to rehab. It still doesn't get reported.
Representative Freeman. Does it have any, Speaker Marsh?
Thank you, Mr. Chairman. What is the penalty for the employer if they do not report it?
Do you know, I don't think the bill actually, I don't think it addresses that.
I guess they just go free then, don't they?
No, I need to fix it.
But, I had several comments sent to me, referred to me, and does your amendment that makes the bill, does it reflect input from any of the agencies that represent TMA or any of those folks, Department of Health?
It does not. I'm sorry. It does not. I've had conversations with a few of them. Actually, this comes from district attorneys.
I've had requests for testimony to be given, Dr. Barron, and if Okay. Yeah, Representative Freeman, go ahead.
And maybe while we're out of session as well, we can ask the question of legal here, but the way I look at it, it says violation of this section is a Class D felony. So that means the employer must file a report with the Department of Health, report it to TBI, which could be a Class D felony is punishable of up to 12 years in prison and a fine of $5,000. Is that not accurate? So if you're in violation, can we ask legal that question?
Sure, Chairman Halsey. I'm going to ask our staff here to opine on that, if we would. We're going to go out of session.
Rajul Bajoy, Office of Legal Services. So if I understand your question correctly, Representative Freeman, you want to know if the changes made by amendment number 12143, if an employer does not report as per section 1, what the ultimate violation that would be. And under section 2, the penalty, which in current law 5311-402B1 states a violation of this section is a Class D felony, that penalty is changed to, or that language is changed to, a violation of subsection A, which refers to knowingly or intentionally distributing the controlled substance. So under this amendment, in short, a physician or an employer that does not report, the violation of that is not specified, whether it's a felony or not.
Does that answer your question? Okay, so let's remain, the no objections will remain out of session and recognize Dr. Barron. Sir, just come up and identify yourself for the record.
Mr. Chairman, members of the committee, my name is John Carr. I'm the Assistant Director of Government Affairs for the Tennessee Medical Association. With me today is Dr. Mike Barron from the Tennessee Medical Foundation. The Tennessee Medical Association is opposed to House Bill 1897. In short, the legislation is duplicative with existing Tennessee law, guts physician referral treatment incentives, and conflicts with existing BME procedure. We have offered Representative Halsey an amendment that it will allow, that's different from the amendment on the bill, that would allow a 3-day window for a physician in this situation to either produce a lawful prescription or report to treatment. In addition, our amendment, that again is not on the bill, is based on TCA 63-1-126, which serves, as we think, a precedent. 63-1-126 is current law regarding the failure of drug screens by healthcare providers. Back to the bill, Mr. Chairman. We also, TMA, find the reasonable suspicion standard in Representative Halsey's bill to be vague for our employers to interpret. With me now, I am going to hand this off to Dr. Barron from the Tennessee Medical Foundation. He's going to outline our concerns as it would affect the foundation.
Thank you very
Yes,
much,
sir.
Mr. Chair. Thank you for having me. My name is Dr. Mike Barron. Last time I was here was about 3 years ago. It was not a very pleasant testimony about medical marijuana. Hopefully this will be a little bit more pleasant. I am the medical director of the Tennessee Medical Foundation, which is a separate organization from the Tennessee Medical Association. Our nickname is the TMF, stands for Tennessee Medical Foundation. I've been the medical director for over 5 years. I'm a board-certified anesthesiologist, addictionologist, and psychiatrist. The TMF is, in essence, the EAP, Employee Assistance Program, for our state's physicians and many other licensees. We are, by statute, a Quality Improvement Committee, QIC. We work very closely and receive RFP grants from health-related boards. We currently have over 225 actively monitored participants. Our sobriety rate at 5 years is over 85%, much higher than anything in the general population. I'm also the volunteer medical director for the Nashville-Davidson County Drug Court, DC-4, and the Women's Recovery Residence. These programs take care of nonviolent felony drug offenders. I've seen firsthand how difficult life and employment could be with a felony on your record. I was appointed to the Board of Medical Examiners in 2010 by then Governor Bredesen and reappointed 5 years later by then Governor Haslam. During those 4 years, I was chair of the CSMD Oversight Committee. I've helped write many rules and regulations for the Departments of Health and Mental Health, including the Tennessee Chronic Pain Guidelines. I say all this because I care about and have worked hard to improve the health care in our state. Addiction is a chronic disease, whether it's alcohol, opioids, stimulants. It is a disease that has a strong genetic predisposition and affects about 15% of our population. And that includes 15% of our healthcare providers. Arresting providers because of their disease is counterproductive. The majority of providers that acquire controlled substances by fraud, forgery, deception, or subterfuge, as written in 5311-402A3, is for their own use. Those drugs do not end up on the street. When a provider gets arrested for addictive behavior, they lose their job, have punitive actions on their license, or lose their license completely, and are unemployable. That is an avoidable outcome, especially when the disease can be and is successfully treated, and the provider successfully returned to work. We have really good peer assistance programs like the TMF in Tennessee for physicians, pharmacists, dentists, nurses, and other licensees. When we are sent to a provider, they get a comprehensive evaluation at their expense. They then go to treatment for 8 to 12 weeks at the inpatient or residential level. They are monitored for 5 years or longer. They go from impaired to repaired. If they violate their monitoring, they go back to treatment or get reported to the licensing board, and then punitive action is then applied. We do not have a revolving door or hide sick providers. We communicate closely with other states as well. This bill would have a negative impact on the stigma of getting help, which is already a big problem. Physicians and nurses are already resistant to getting help for a mental illness because of the potential repercussions: loss of license, loss of hospital privileges, loss of their job. This bill will only add to the fear of getting help. It will drive providers with any type of illness, mental or medical, further underground. Physicians and others monitored in our program do not get lost to follow-up, do not go from job to job. This bill may actually promote what it's trying to prevent, as providers will be encouraged not to get help and to quickly leave their employment if there's a hint of trouble. I understand what this bill is trying to accomplish. The problem is complex and on multiple levels. We currently have good systems in place to deal with these complex issues. This bill could help solve this problem if it was amended, as was suggested, for referral and utilization. We are already facing a healthcare shortage, a healthcare provider shortage, in especially rural areas. This bill as written would add to that problem. Thank you for your time, and I'm, of course, open to any questions.
Yes, sir. Thank you, and Representative Smith, or pardon me, Chair Lady Smith.
Thank you, Chairman Ramsey. Just one question. Let's take healthcare provider out of this bill, and let's insert Tennessean. If they had stolen, narcotics, and maybe this is a question for legal, would they receive the same treatment, or are we creating a false protection around certain licensed providers? Because again, I'm very pro-provider, but I also know that if we're creating a protected class within, because clearly controlled substances are very seriously, and I hope if I've not asked that question clearly enough, let me know.
Is that something you feel comfortable in answering?
Yes, sir.
Okay, go right ahead.
Yes, ma'am. Physicians, like nurses, like lawyers, are safety-sensitive workers. We hold them to a higher standard than the general population. So we're very quick to pull them out of their workforce, like airline pilots, and send them to a long-term recovery treatment program. Someone that breaks into a drugstore to steal drugs generally isn't stealing drugs for themselves. They are diverting that for money. Physicians, nurses that divert drugs in hospitals or write prescriptions to themselves, it's for their own use. It's for their own drug use. They're not diverting it, putting it on the street, harming other people. They're just harming themselves. It's a disease, addiction is, with horrible behaviors as a result. Does that answer your question, ma'am?
Chair Lady Smith. Do we, yes, sir, you're recognized.
Mr. Chairman,
Mr. Carr.
Representative Smith, to add to that, with respect, our healthcare providers, especially physicians, they have some different, the profession's treated differently. If they do violate the terms of their license, they are reported to a national provider database, which I don't think is the same for average Tennesseans. There's no national database if you're fired from a job. So there are some differences, especially with physicians.
Chairman Todd. Oh, Boyd, I'm sorry. Got the same number of letters.
Thank you, Chairman. We should get to know each other. Appreciate y'all coming today, and I want to echo what my colleague said. I think it's I'm actually surprised to learn that physicians, nurses, and employees in the medical community can steal and not be reported. I mean, I'm kind of shocked at that. And in this day and age with narcotics, opioids, everything, I'm really surprised that to see the opposition to this. Just out of curiosity, what was your amendment going to do?
It would mandate treatment and a referral to the medical board if they opted out of treatment. We do have physicians in our program that have felonies on their record. I could think of 3 offhand very easily that were arrested. That was their entry into getting help. All 3 of them, only 2, one went back to work in a jail, of all places, and the other 2 are still looking for work. And they're licensed individuals. It keeps them out of employability. When again, we already have a healthcare shortage in this country. Under COVID, that's made it much worse. Addiction is a disease, and we need to treat not only physicians with addiction appropriately, but the general population. I've worked with law enforcement. I have a good friend that's high up in the Tennessee Bureau, and his quote is saying, "We cannot arrest our way out of this problem. We have to provide prevention and treatment. That's how we get out of this problem."
Chairman Boyd.
Thank you, Mr. Chairman. If they were reported, there would still be the option of the facility, whether they wanted to press charges, and the district attorney would have the authority, I'm sure, to divert them into some program like this. Why not let the legal system just work its way out? It's unlikely that if they truly had an addiction that they would go to jail. I would imagine that they would end up in a program like this anyways.
Dr. Barron.
Yes, sir. Thank you. Yes, they would, but with a felony on their record, they're basically unemployable.
Further, yes.
Thank you, Mr. Chairman.
Speaker.
The way I understand what Chairman Hulsey's bill is trying to do is to say that if you have a doctor or a boss over some people, and they find that this employee has taken something that they shouldn't have, they have the responsibility to basically to turn them in, or they're going to be in some kind of problem. They're going to break some kind of this law, I suppose. But what if you have a great employee and you don't want to turn them in? You want to give them some help. I think that's what you're saying is you want your employee to be helped instead of having to go to be arrested.
Yes, sir. No, they need to get out of the workforce immediately. Whenever a physician, nurse, healthcare provider is impaired in any way, the first thing to do is remove them from their clinical responsibilities. Second thing is to get them the help they need. And then, over weeks, months, years even, to get them back to work, trained with what they're able to do.
And what I see the problem could be in this legislation is that if the doctor saw the theft or them taking it, and they wanted to help them out, and they did, but they later found out that you didn't turn them in, then you're going to be the one that's in trouble for not turning them in, which I think that could be a real problem.
Yes, sir.
Let's see, I think Representative Freeman, you had questions of the witnesses.
Yeah, I do, and I want to ask a question and make a comment on what we've been talking about. So currently as a business owner, we've had to change our policies, as in we don't take cash anymore, some of these things, to make sure that some of our employees, the opportunity crimes, if you will, are removed. And almost without exception, we have worked with our employees, recognizing they are in a tough position. And I kind of look at it, what you're saying here, as a similar crime. It's a crime of opportunity. If I broke into the hospital and had possession of a narcotic, the crime is multiple steps, but breaking and entering would be one of them, which if a physician or a nurse is diverting a narcotic, the crime is not necessarily possession as much as it's illegal possession or illegally obtaining it. And I too agree that, you know, we cannot criminalize this out of existence. We cannot continue to put people in prison and you know, remove their ability to make a living. We need to make sure they get help. And so is my understanding correct? And I think we just addressed it. You would not have the ability, if this passed, to work with an employee to make sure they get help. You would be forced to turn them over to law enforcement. Is that the understanding?
Yes, you recognize Dr. Barron.
Thank you, sir. Thank you, Mr. Chairman. Thank you. No, as far as I understand, the employer is mandated to turn them over to law enforcement, not the physician health program or the nurse's health program.
I misworded my question. That's what I was asking.
Okay.
So, okay, thank you.
And did we have anybody else that wants to speak? Yes, you're recognized, Mr. Carr.
Mr. Chairman, just want to add, currently 225 physicians are in treatment with the foundation. Just wanted to get that number out. Just
Okay.
doctors.
Okay. Do we have further? Oh, Dr. Terry, you're recognized.
Thank you. And I just want to get a clarification on this. Basically, an addiction being a medical issue, a disorder, versus diversion, where you're selling, and there are laws on the books for diversion to sell that they would be punished under that if they were selling it. What you're saying, this is somebody's medical condition, you're getting them treatment, a felony to them. And I'll give you an example. I know somebody that this occurred to them and went into treatment, and they've been practicing and don't go anywhere near the narcotics. Flip side, not necessarily want to give a plug to any TV show or whatever, but Dirty John, the show Dirty John, having to deal with somebody that was stealing fentanyl, sending it across state lines. That person was here in Tennessee. And so those are on the books, and that's a felony that they would go after them for that. So that's different than somebody that has a medical issue. And that being said, you know, when you're doing your medical license, have you ever had a drug problem? Have you had a felony? Those are things that are going to be reported, going to be on there. And like you said, you may not be employable, but there are people that once you get help and get treatment can still be good practicing doctors in our communities. Thank you.
Okay. Chairman Boyd, you're recognized.
Thank you, Mr. Chairman. I'll wear a name tag next time I'm in this committee. I just want to clarify. I mean, I want to make sure I've got this right, because listening to you guys talk, you're talking about addiction, And there's nobody on this committee, including myself, that wants someone turned over to law enforcement for having an addiction. And if a doctor did have an addiction, we would hope they would get treatment and continue with their career. But I did not realize that a physician could steal. They could literally steal something and give it to their friends or sell it or take it themselves or whatever, and that they were getting away with that crime. And I just have a problem with that. It's not the addiction part, it's the stealing it part that I'm concerned with. And so maybe when we go back into session, the sponsor can clarify. I thought we were talking about the fact that they were stealing medicine. I understood that's what his bill addressed, not addiction. So if either one of you want to clarify that, I'd like to make sure.
Yes, Dr. Barron.
Thank you, sir. Addiction is a dirty disease. If someone's diverting drugs for their own use, writing prescriptions to themselves, those drugs are not ending up on the street. That is part of the disease of addictions, like driving under the influence of alcohol, part of the disease of alcoholism. If they're writing a prescription for monetary gain, that's not addiction, and those people should be punished under the law. But this bill would punish everybody under, if they're diverting, if they have a sample of hydrocodone in their office and they use it for their own use, and their employer found out, this bill would mandate that they're turned over to law enforcement.
Does that answer your question, Chairman? We have further comments or questions of the witnesses. I think this is an excellent. Oh yes, Mr. Carr.
Mr. Chairman, just to Chairman Boyd's question, the references to 53-11-402 fraud. It's not theft. So it'd be like the prescribing that Dr. Barron has mentioned for self-use.
Does that answer your questions? You recognize I think questions have popped up. Somebody sent me a text here. What's reasonable suspicion and what's the criteria for an employer without some kind of definition? What's a reasonable criteria for an employer being an expert on that? It can certainly be difficult. And I think this is an excellent spot for us to recognize regulatory boards, because they do take care of these issues. The Dental Society or Dental Association has a rehab program. The Medical Association, I'm sure the nurses do too. And we all recognize the words that come to us from Dr. Stephen Lloyd. He's become a spokesperson statewide for opioid addiction, having suffered through it himself. Were he to have suffered the incarceration and legal issues that would come from a bill like this, would he have been in a position to be in that spokesperson today? Or would he have been an ex-con that nobody would listen to? And he's a huge, powerful voice. So do we have other questions or comments? If not, I will release our two witnesses. Thank you so much for your information.
Thank you, sir.
Back in session, and Chairman Hulsey, you're recognized.
Thank you, Mr. Chairman, and thank you, folks, for testifying. And I want to reiterate something. I'm not anti-rehab. Addiction is not a crime, but stealing other people's medicine is, and the code says that. And there's no other profession in the state of Tennessee where we'll cover somebody's crime in the interest of getting them rehab. Truck driver who's got an addiction to alcohol, and he wrecks his truck and he gets arrested and he gets a license suspended. It's taken away and he loses his job until he can earn it back. and he very well may go to rehab, but he doesn't bypass the criminal justice system. This is the only profession in this state that we do this to. And I want to tell you, most of the time, and by state code, if you go in front of a judge on these kinds of charges, you get diversion, you get it judicially to go to rehab. So I'm not against rehab. I think it's absolutely essential. It doesn't always work. Up in Bristol, there was a nurse in there in the COVID ward, stealing the guy's medicine that's in an induced coma, so bad to the place that he wakes up, and that's how it was discovered and not reported by the supervisor. Under this law, he would have to, but this was reported by somebody else. So the guy got charged, went and got diversion in front of the judge, went to rehab. Came out of rehab, and the same facility up there hired him straight back in there, and he turned around and reoffended. I'm not against rehab. I think it's absolutely essential, and I think it's important. But this is the only profession that we do this way and divert around the judicial system and the criminal justice system when crime's been committed. And so that's all this does. This says you got to report it just like child abuse. You don't take child abuse, folks, and say a school teacher who's supposed to report child abuse but talks to the mom or the dad, and the mom or the dad say, well, look, I'll go to rehab. Oh, okay, well, we won't tell anybody. That's not the way you do it. And that's what this law does. It brings this profession and this problem in the same light as the other two, and it makes a forced reporting system. So,
further comments or questions of the sponsor? If none, we will be voting to send this bill as amended to full committee. All those in favor say aye. Any opposition? No. Bill fails. Thank you, sir.
Thank you, Chairman and committee.
We move on to item 12. House Bill 2486 has been rolled 1 week. That's by Chairman Werner. And item 13, House Bill 2298 by Chairman Holtzclaw has been taken off notice. Item 14, House Bill 2259 to roll 2 weeks. Item 15, HJR 742 has been taken off notice. House Bill 1971 by Representative Lamar has been rolled 1 week to the heel. Item 17, House Bill 2416 by Chairlady Smith. Do you want to roll that to next week? Or do you want to hear it today? We got 5 minutes.
Mr. Chairman, rather than using a roll, I mean, I would concede to the committee, this is going to take some discussion.
Okay.
And so rather than...
we'll just roll you to the heel and
that
take it
works.
up next week.
Thank you.
Okay. So thank you. The item 18, House Bill 2857 by Kumar has been rolled 1 week. Item 19, House Bill 1960 by Chairman Hulsey. Is this going to be a quick one, Bud?
It's quick. It's very quick.
We've only got 1 minute. We're going to roll you to the heel.
You're going to roll me to the heel?
Pick you up next week.
The heel will be about 60 seconds?
Yeah. Item 20, House Bill 1871. Yeah.
Let's just roll the remaining
Okay.
balance to next week's
Okay.
calendar.
None of the rest of, okay.
No.
All the rest of our items have been rolled to the heel and be taken up next week. They do not incur a roll against their record, so we will begin with those items next week. We have comments or questions, personal orders. If none, we'll stand for adjourn.